Hello, I'm Dr. Kiran. I welcome all the new keen youngsters who wish to join to this IRT program, International Research Trainee Program for medicos and doctors. Today's topic is ingrown nail. Some may ask, Doctor, you're an orthopedic surgeon. What role do you play in ingrowing nail? Now, my answer is there are certain areas like a spine surgery can be done by a neurosurgeon and an orthopedic surgeon. So likewise, it is ingrown nail comes into the purview of podiatrists, foot and ankle specialists. It comes under general surgeons, general practitioners, and many other practitioners. The very fact the ingrown nail, once it occurs, it recurs. That really is a big problem to the sufferer, the patient.
What is an ingrown nail?
Before I go into what is an ingrowing nail or ingrown nail, let us understand what is a normal nail. Initially, at this level, you have the vest into which the nail looks as if it is inserted. It's other way around. It is secreted out. It is coming out from the nail vest under which the germinal matrix is there. So, the nail fold with germinal matrix below. Eponychium. See, if you can observe, there is a moon-shaped area. It is called as lunula. And then it is followed by the sides, the skin. The skin is covering the nail edges at medial and lateral with a peronicium. Okay, there is a peronicium. And as we go, we have hyponychium under the nail. At the distalmost end, there is a light hypopigmentation. It is called as onychodermal band. And then the middle part is called as the nail plate with sterile matrix below. This constitutes the nail structure. So please stop here, summarize by looking at the picture, try to draw the diagram of a nail. It may be useful to you forever in life. Now when you come to the sagittal section of the nail, this gives more information, and the information is, see, you have the hyponychium under the nail, you have a nail bed, chorion, nail plate, insertion of the terminal tendon into the proximal part of the distal phalanx, and then this nail plate has a dorsal roof, a ventral roof. Nail plate has a dorsal roof and a ventral roof. And then after that, distally you have a germinal matrix. Middle you have sterile matrix or the nail bed epithelium, NBE. So sterile matrix or nail bed epithelium, NBE, plus the germinal matrix, that is called as the nail bed. If somebody asks you, Doctor, nail bed, you are saying, or you have a orthopedic surgeons will say nail avulsion with the nail bed involvement. Don't use anything which you don't understand. A word you use in the biology, you should understand which structure. Nail bed means the nail bed epithelium plus the germinal matrix. If that is lost, it is the nail bed injury is confirmed. Okay, now let's come to the ingrown nail. So the question by Aditya Acharya is,
what is the basic reason behind ingrown nail?
What is an ingrown nail? Normally the nail grows like this. It comes out like this. If this is the nail vest coat, correct? It is covering like this, correct? And the nail will go and grow like this, correct? If it is straight, nothing is happening. But if it is like this, due to any reason, it is going to surely cut. These are the peronicium, my skin folds.
What happens to the skin and surrounding tissues in ingrown nail?
It's going to cut into my skin folds as it comes out, and these get red, inflamed, irritated, they start oozing out, inflammatory, exudate, and may get infected, may become chronic, and these two layers, which we are calling as the peronicium, may show secondary changes, and they become tough, fibrous, and they don't heal properly. That is an ingrown nail. That is why just removing a bit of the nail may not solve your problem. I have got a relative Since 35 years, she is suffering from the ingrown nail and its sequelae. So whatever done, it may still recur and multiple surgeries may be required. That's why I said don't take it easy when somebody has come to you with a complaint of ingrown nail. Try to do the best for them.
What are the genetic concepts of ingrown nail?
Yes, genetic causes. Yeah, they have said that it runs in families. A lot of research is being done to see if genetic causes determine the occurrence of ingrown nail.
Sir, does any food abnormality cause ingrown nails?
Sagarika Jayakumar, thank you so much for your question. I was surfing through various articles that were published and I found a study which was made on various food abnormalities with which ingrown nail was associated more. They concluded and inferred that pes planus and valgus foot could contribute to this ingrown nail. This is the power of research and power of surfing to learn more. The thirst to learn more must be there. That's where this IRT program was designed and founded by me.
Other foot abnormalities associated with ingrown nails: hallux valgus, already mentioned, improperly trimmed nails, abnormal shape of nails, hypertrophy of the lateral nail folds, congenital or acquired nail disorders, nail infections, and any factor that enhances the external pressure such as tight shoes, genetic predisposition, obesity, trauma, subungual tumors, excessive sweating, and certain medications. So, do you know medications which can result in an ingrown nail? Surprising, no? Selumetinib. Selumetinib induced paronychia is just an inflammation which causes delayed onset erythema, swelling, ingrown nail, and it resolves upon interruption of the treatment. You can refer to this article made in 2018. So, coming to home-based therapies, soaking the nail in warm water with or without Epsom salt, special orthoses which are available in the market for reduction of the pes planus or hallux valgus, proper nail care, taking care of the diabetic control, avoiding narrow footwear and high heels with pressure on the forefoot. These are the common precautions we can use.
Okay, so doctor, can you please tell us or share us some light on how does braces help in case of ingrown nails?
How many of you know 3-point pressure? So here what happens? We have seen dental bracing. So we have seen bracing in even in orthopedic orthosis and prosthesis. We use the 3-point pressure sometimes. Yes, 3-point. Two areas we put the pressure, and one area the pressure is the reverse direction. So even during the reduction of fractures, Lohmann's clamp, which utilizes the same procedure. So what's happening here is this distance is decreasing, and these two are catching the part and pulling it up, whereas this one is pushing it down. So any mild angulations can be corrected, and also a plate can be put. Same mechanism. A 3-point pressure application can be applied. How? From here and here it is lifted. From the center, just see this. Okay, my index finger is pushing it down, while my thumb and my middle fingers on this nail, what are they doing? They're lifting it up. Again, my index finger is pushing it down, and my thumb and my middle finger are pushing it up. This is how bracing works. It has to be repeated. Remember, we have to understand that if the nail is too hard, this bracing won't work. Even if it works, it goes back.
And also, what is the surgery that is indicated in case of ingrown nails?
So, the surgery is always difficult and may require multiple sittings.
Before we do any surgical intervention, proper nail care and other conservative methods give a good relief usually. Then when we come to surgery, matrixectomy, that is removal of the germinal matrix, which is a permanent method of treating an ingrowing nail. Various other procedures like Van den Bosch procedure, where matrix is not touched. It is just a release of the soft tissues. And on the left side you see vinograde procedure, where wedge resection and matrixectomy are done by also extension of the incision along the side of the nail to the proximal part of the distal phalanx. This is a much bigger procedure and it is more permanent vinograde procedure, and these procedures must be known to the surgeon to decide which procedure he would like to adopt.
What is the course of a patient, or we can say prognosis, in a patient who is partially treated in case of ingrown nails?
Prognosis or the course of an ingrown nail after it is partially excised. It's a nice question. So, how partially have you done it? How well you have removed the ingrowing aspect, the cutting aspect of the nail. It should not be like this. It should be a little like this. Have you achieved it or not is important. If it is still like this, when it grows again it will cut through and come out. This is the peronicium. It's again going to cut through and grow out. Again it's going to come. So what you have to do when extensive nail removal is required. So here comes many more alternatives. Do you know what alternatives?
Scott is 18 years old and he obviously has an ingrown toenail. It's going on for 6 or 9 months. He's had 3 antibiotics and it's still not clearing. Obviously he needs surgery. We're going to demonstrate how to do a ring block anesthesia first. I've already cleaned, so this is a nail nippers. We're going to split it down. That's not always possible. So you can see the toe's gone a little bit white. Now we're ready to split the nail. I've already cleaned, so this is a nail nippers. We're going to split it down a quarter on either side. So here is a quarter, split down, and here's a quarter. So a good bit of pressure here. That's all?
No.
Okay, so once you've cut down the nail, then we use the nail chisels. So it's a chisel, pretty much like any chisel. It's going to split the nail under the periungual skin. So a lot of pressure here. We're going to split it right down, and then split here, and split it right down. We lift off the nail, so we get in under the nail. You feeling anything, Scott? Get right down to the base of the nail, and then we twist it like you open a can of sardines. So we're twisting it off, and just being careful not to lift the nail that's left behind, only lift the bit that's coming out. So you can see that pretty much picule, which is not serious but is a bit uncomfortable for the patient. So this bit, we can take away some of the granulation tissue, so we can see what. Then you get the swab, which is soaked in the phenol, and you just put it into the corner in here, and then you just make sure it goes down well, and then you just agitate it a little bit and leave it in there. You should time this on a clock for about 1 minute, and that's a minute. But what we're going to do is, instead of phenol, we're going to use radiosurgery. So this is using radio waves to destroy the nail bed, and we have a little electrode. And the electrode is Teflon coated on one side, which is inactive, and then it's just a bare electrode on the other side. So everything on this side is going to get burnt. Everything on this side won't get burnt. We're going to hold it with the burning side down so as to try and destroy the nail bed. We're just going to do this for about 10 seconds. You okay, Scott?
Yeah.
You feel anything?
No.
When you're doing this, sometimes you hear a bit of crackling and see a bit of smoke. You see a bit of smoke there coming through, and a little bit of crackling, and then dress it.
Hope you enjoyed my topic on ingrown nail and the edited version of the last video. So bye for now. Meet you again with another topic. Bye bye.